Okay, imagine this. You think you're really well informed about something, maybe a bit niche, right, like a pub quiz fact. But then, bam, you realize it's got these huge, like, global consequences. That's kind of the rabbit hole we're jumping down today. We're going to unpack something that sounds, well, pretty specific to farming at first. Ascaris suum, the swine roundworm. Now, it's definitely a big challenge in agriculture, no doubt, often linked just with pigs, but its reach, much wider than you might think. So our mission today is basically to give you the shortcut, a real deep dive into its, well, surprising biology, its hidden costs, the economics of it all, and some really critical public health stuff, too. You might be genuinely surprised. Okay, let's unpack this.
Yeah, and what's fascinating here is how something that's, been around for basically millennia still poses such a complicated and really broad challenge today. Like you said, it's not just about the pigs, not at all. It's really about this deeply connected system. It hits food production, economics, even our own health. I think by the end of this, you'll definitely have those aha moments. You'll see the connections.
Great. So let's start with the main character then. Ascaris suum. Describe it for us. It's a large intestinal roundworm, mostly in pigs, right?
Yeah.
And a big deal globally.
Exactly. A major parasitic infection worldwide. And when you say large, you're not kidding. These aren't microscopic. The adults are pretty substantial. They're stout, sort of whitish pink worms living right there in the small intestine.
Okay.
And you can easily tell males and females apart. That's sexual dimorphism. Males are, say, 15 to 31 centimeters, so half a ruler, maybe more.
Wow.
But the females, they get even bigger. We're talking 20 up to nearly 50 centimeters sometimes.
Half a meter. That's huge, like forearm length inside a pig.
Pretty much. It's impressive in a parasitic way. And they both have these 3 distinct loops around their mouth.
Okay, but what makes them so successful, so persistent?
Well, that comes down to the egg. The egg is the absolute key. Visually, they're tiny ovals, maybe 45 to 75 micrometers, so like a speck of dust, golden brown color. But the critical part is the shell. It's got multiple layers, it's thick, and it has this bumpy, mammillated surface. Or think of it like body armor on a microscopic scale.
Body armor.
Seriously, this shell gives it just extraordinary resistance to almost everything. Drying out, freezing. Most chemical disinfectants, they just shrug it off. This is the single most important thing to get. That egg is practically indestructible in normal conditions.
Right, so you can't just, like, wash it away easily.
Not at all. That resilience is why it's such a persistent problem. It means the egg can stay viable, ready to infect in the soil for months. Years, even. Some studies suggest, believe it or not, 6 to 15 years.
15 years. In the soil.
In the right conditions, yes. It fundamentally shapes the whole challenge of control.
Okay, that resilience explains a lot. So a pig eats one of these armored eggs. Then what? You mentioned a journey.
It is quite the journey. So ingestion is step 1. The pig picks up infective eggs, ones containing a little larva, the L3 stage from contaminated soil, feed, water, whatever. Inside the pig's gut, the larva hatches. Then, invasion time. It penetrates the intestinal wall.
Right to the bloodstream.
Yep. Enters the portal circulation, heading straight for the liver. Spends about a week, maybe a bit more, migrating around in the liver tissue, causing damage as it goes.
Got it.
Then it gets back into the bloodstream, travels to the lungs. In the lungs, it breaks out of the tiny blood vessels into the air sacs, the alveoli. Then it performs this migration up the windpipe, the trachea.
It crawls up.
It does. Gets coughed up into the back of the throat, swallowed again.
Whoa.
And finally arrives back in the small intestine. That's where it settles down and matures into an adult worm.
That whole trip, just to end up back in the intestine?
Seems counterintuitive, but yeah. And once those adult females mature, they become egg factors. Estimates range from 200,000 eggs up to possibly over 1 million per female per day.
Per day.
Per day. These eggs then pass out in the pig's feces back into the environment, ready to start the whole thing over. And that whole cycle from ingesting an egg to the pig shedding new eggs takes about 6 to 8 weeks, what we call the pre-patent period.
40 to 53 days, roughly. Wow.
And this biology, this whole complex cycle, directly impacts how it spreads. Epidemiology, we call it. That nearly indestructible egg is central. Transmission is almost entirely fecal-oral.
Makes sense.
And what's fascinating here, too, is the egg's outer coat. It's sticky, so it easily clings to things. Boots, clothes, shovels, equipment, what we term fomites.
So people can spread it around without even realizing.
Easily, between pens, even between farms. And then you have carrier animals, adult sows, for instance. They might have a low-level infection, seem perfectly healthy, but they're constantly shedding small numbers of eggs, contaminating the environment for their piglets. Which, this raises an important question. How does something so small cause such a big problem, and often a hidden one?
Yeah, you mentioned damage in 2 phases. A double whammy, I think you said.
Exactly. It's helpful to think of it in 2 waves. First, there's the damage from those migrating larvae. That's often the hidden damage. When they tunnel through the liver, usually in that first week or so, maybe 7 to 10 days after infection, their movement physically damages the tissue, causes bleeding, inflammation. It's a parasitic interstitial hepatitis, technically.
Okay.
On a postmortem exam, you see the results as these distinct, whitish, fibrous scars on the liver surface. They're commonly called milk spots.
Milk spots, I've heard that term. So that's direct evidence of infection.
It is, but here's the crucial insight, and it's a bit tricky. Those milk spots are temporary, they're transient. They usually heal and disappear within, say, 1 to maybe 4 weeks after the larvae have moved on to the lungs.
Oh, so if you check a pig later, the spots might be gone, but the infection could still be there.
Precisely. This makes liver condemnation rates at the slaughterhouse a potentially misleading snapshot. You might have a low rate of milk spots found at slaughter, suggesting things are okay, but it could just mean there haven't been new infections in the last few weeks. It might totally mask a really heavy ongoing burden of adult worms in the intestines that have been dragging down performance for months.
That is a huge diagnostic blind spot then.
Yeah.
Wow. And the damage isn't just the liver, right? You said lungs too.
Absolutely. That's the next stop on the migration tour. When larvae break into the lung air sacs, it causes tiny bleeds, inflammation, basically verminous pneumonia. In really heavy infections, especially in young pigs that haven't met the parasite before, this lung damage can be quite severe. Clinically, what you often see is this moist cough, maybe some respiratory distress, and very characteristic, this spasmodic abdominal breathing. Farmers call it thumps.
The thumps, like the pig is thumping.
Yeah, the abdominal muscles contract forcefully with each breath. It looks like their sides are thumping. It's a classic sign of Ascaris larval migration in young pigs. And what's more, this lung damage can weaken the pig's defenses, makes them more vulnerable to secondary bacterial or viral pneumonias. So it compounds other respiratory problems.
Okay, so that's the chaos from the migrating larvae. But what about when they finally settle down in the intestine? Does the damage stop then?
No, it just changes character. It becomes less about acute tissue damage and more about a chronic nutritional drain. Once those large adult worms are living in the small intestine, they cause problems in a few ways. First, direct competition. They're literally eating the food the pig eats, right there in the gut.
Stealing nutrients.
Exactly, stealing nutrients. Plus, their presence causes chronic irritation and inflammation of the intestinal lining. This leads to damage and flattening of the villi, those little finger-like projections responsible for absorbing nutrients. So the pig can't digest or absorb its food properly. Malabsorption.
So less nutrition getting in, and the worms are taking some of what does get in.
You got it. That combination is why you see the main economic impact. Poor feed conversion efficiency, reduced weight gain. Pigs just don't grow as well as they should. Now, light infections might not show obvious signs, but heavier burdens. You'll see unthrifty pigs, slow growth, maybe a rough, dull hair coat, sometimes called hairy pigs. Intermittent diarrhea can happen too.
Hairy pigs. Huh?
And in really severe cases, you can get serious complications. The sheer number of worms can physically block the intestine. That's an emergency. Or sometimes adult worms migrate aberrantly. They might wander up into the bile duct, block it, causing jaundice yellowing of the skin and tissues. That can be fatal. Occasionally, you might even see worms expelled through the nose or in vomit. Quite dramatic.
Wow, okay, that paints a picture. And this brings us to the economics. You hear Ascaris Suum called the most economically damaging helminth, the most costly worm in pigs globally. How does that add up?
It really does add up, and often in ways that aren't immediately obvious, hence the hidden loss aspect. Even those seemingly mild infections, the ones without clear clinical signs, they depress feed intake and slow down growth rate, the average daily gain. There have been studies, quite detailed ones, showing infected pigs need significantly more feed to reach market weight.
More feed for the same weight gain.
Exactly. One key economic analysis back in 1999, actually, but still relevant, estimated that pigs with even a light Suum infection needed about 5.6% more feed. Extrapolated across the whole U.S. swine industry then, that worked out to an estimated cost of over 60 million US dollars just for the extra feed.
60 million,
Yeah.
just from slightly less efficient growth.
Just from that. The physiological basis is clear. The parasite messes with the gut's ability to transport key nutrients like glucose and amino acids across the intestinal wall. Then you have the more direct losses at slaughter. Organ condemnation, livers getting rejected because of those milk spots we talked about.
Right, the transient ones.
Yeah. A survey in Belgium found about a 14% liver condemnation rate due to milk spots. Extrapolate that kind of rate to, say, Eastern Europe, and the estimate was around 17.5 million US dollars lost annually just from condemned livers. And sometimes, though it's less common, whole carcasses get condemned if there's severe jaundice from worms blocking the bile duct. But here's the really critical point. Those indirect losses, the reduced feed efficiency, the slower growth, they usually far outweigh the direct costs of condemned organs. It's the silent drain that costs the most.
That silent drain is a really powerful way to put it. And given the signs can be subtle or those liver spots misleading, diagnosis sounds like it needs a careful approach. How do vets and farmers figure this out for sure?
It is definitely a puzzle sometimes. You really need to combine observations on the farm with lab tests and ideally postmortem findings to get the full picture. Each piece tells you something different. On the farm, you're looking for those general signs. Poor growth, unthriftiness, that hairy pig look. An outbreak of coughing and thumps in younger pigs is a massive red flag for the larval migration phase. For laboratory diagnosis, the standard is fecal examination, looking for the eggs under a microscope. This tells you if you have a patent infection, meaning adult worms are present and laying eggs. We usually use a flotation technique, like the McMaster method, often with a saturated salt solution to help the eggs float up for counting.
But you mentioned the diagnostic gap.
Exactly. This is the key limitation. Fecal exams cannot detect pre-patent infections. Remember that 6 to 8 week window between infection and the start of egg shedding. During that whole time, larvae are causing damage in the liver and lungs, but there are no eggs in the feces, zero. So fecal exams are good for monitoring chronic burden in a herd, but they won't catch an acute outbreak early.
So how do you catch it early then?
That's where postmortem examination or necropsy is so valuable, especially during that pre-patent phase or in cases of sudden death or severe illness. You can directly see the milk spots on the liver, assess the lung damage, find the larvae, and of course, see the adult worms in the intestine if they're present. It's the most definitive way. And looking forward, there's work on emerging technologies. Serological assays, ELISAs, that detect antibodies the pig produces against the worm. These hold promise for detecting exposure earlier, potentially bridging that diagnostic gap.
Right, so a really challenging parasite to diagnose and manage. It sounds like there's no single magic bullet for control then.
Absolutely no silver bullet. No way. Effective control of Ascaris isn't about finding one perfect solution. It demands a really comprehensive, integrated approach. You have to combine strategic medication with really strict environmental management. The goal is to break that incredibly resilient life cycle at multiple points. It's got to be a multi-pronged attack.
Okay, so what are those main prongs? What are the pillars of that attack?
Two main pillars, really. First is anthelmintic therapy deworming, using the right drugs at the right time. Common dewormers include things like fenbendazole, flubendazole, those are benzimidazoles. Then you have ivermectin and dormectin macrocyclic lactones, and others like pyrantel or piperazine. But here's a crucial difference. Their activity against different life stages. Some, like the benzimidazoles and macrocyclic lactones, have larvicidal activity. They can kill the migrating larvae in the liver and lungs. That's important if you're dealing with thumps.
Right, hitting them during that damaging migration.
Exactly. But there's another key difference, the ovicidal effect. Only the benzimidazoles, like fenbendazole and flubendazole, significantly disrupt egg development inside the female worm. This means many of the eggs passed in the feces after treatment are non-viable. They can't infect another pig. That helps reduce environmental contamination. Other drugs, like ivermectin, kill the adult worms effectively, but the eggs passed shortly after treatment might still be perfectly viable.
Well, that's a really important distinction for long-term control.
Huge difference. So strategic deworming programs are designed around this. For the breeding herd, deworming sows maybe 1 to 2 weeks before they farrow is critical. It reduces egg shedding just as piglets are born, protecting those highly susceptible newborns. For growing pigs, strategies vary. Maybe continuous low-level medication in the feed, or more commonly periodic pulse treatments, say every 6 to 8 weeks, timed to kill worms before they mature and start shedding eggs.
Okay, so that's the medication side. What's the second pillar?
The second pillar is environmental and management control, and Honestly, this is often the most critical part, but also the most difficult. Why? Because of that incredibly tough egg we keep talking about.
Right, the 15-year survival thing.
Exactly. Standard disinfectants you use for bacteria or viruses. Largely ineffective against Ascaris eggs. Forget about it. You need really thorough physical cleaning first. Removal of all manure. High pressure washing, ideally with hot water and detergents. Scrape everything clean. To actually kill the eggs reliably, you need extreme measures. Steam cleaning is effective. Direct flame, like carefully using a flame gun on concrete floors, obviously with safety precautions. Or strong caustic soda solutions, again with strict handling protocols. It's serious stuff.
Not just a quick spray down there.
Yeah. Not even close. And then there are the husbandry practices.
Yeah.
The all-in, all-out AIAO system is fundamental for breaking transmission cycles. Moving pigs in groups, completely emptying a barn or room between groups, allows for that essential, thorough cleaning and disinfection time. No overlap between batches. So hygiene is also vital. Physically washing sows, especially their undersides and udders before they move into a clean farrowing crate, removes adhered eggs. Simple, but effective. And for pigs raised outdoors, pasture management is key. Regular rotation, letting paddocks rest. Tilling the soil in rested areas can help expose eggs to sunlight and drying, which does reduce viability over time. But it's a slow process. It's a constant battle.
Wow, it really drives home how tough this parasite is. So thinking about all this, it's clearly not just about the pigs, is it? This really feels like it's heading towards that bigger picture you mentioned earlier, the One Health idea.
Absolutely. This is where the story broadens significantly. Ascaris Suum has really significant public health implications. It's now unequivocally established as a zoonotic pathogen.
Meaning it can infect humans.
Yes, it can infect people. For years, there was debate. It looks almost identical to Ascaris lumbricoides, which is the common roundworm species primarily found in humans. Hard to tell apart just by looking under a microscope. But the molecular evidence now is conclusive. DNA studies show they are genetically very, very closely related. Cross-infection definitely occurs the pigworm infecting humans, and potentially vice versa. And they can even hybridize.
They can interbreed. Wow.
Potentially, yes. So how do humans get infected? Primarily through ingesting those infective eggs. This could be through direct contact with pigs or their manure, say for farm workers or children playing in contaminated areas, or perhaps more commonly for the general population, indirectly. Contaminated food, maybe vegetables grown using pig manure as fertilizer if not properly composted, contaminated water sources, contaminated soil itself.
So it can get into the food chain or the environment people interact with.
Precisely. There's real-world evidence, too. Studies in places like Denmark, for example, where human Ascariasis isn't super common anymore, have genetically typed the worms found in human infections. And a significant proportion turned out to be a Suum of pig origin. It confirmed pigs are acting as a zoonotic reservoir.
Okay, and what does that mean for control?
It means control efforts can't just focus on one species. They can't be siloed. Trying to eliminate human Ascariasis with mass drug administration programs alone won't work if there's a constant source of infection spilling over from pigs. And equally, just deworming pigs on farms isn't enough if farm workers aren't protected or if environmental contamination persists and affects a wider community. You need a coordinated One Health approach, recognizing that human health, animal health, and environmental health are all completely intertwined. It's essential for tackling a parasite like this.
That's a really powerful connection. So if a person does get infected with the pig roundworm, what does it actually look like clinically? Is it the same as the human one?
Largely, yes. The clinical picture is pretty much indistinguishable from infection with A. lumbricoides. If it develops into full-blown Ascariasis, you see that same hepatotracheal migration we described in pigs. So there can be a pulmonary phase as the larvae pass through the lungs. This can cause respiratory symptoms, dry cough, wheezing, maybe a fever, sometimes called Leffler's syndrome.
Okay.
Then once the worms mature in the intestine, that phase can be asymptomatic if it's just a few worms. But heavier infections can cause abdominal pain, nausea, maybe diarrhea. And especially in children, chronic infection can contribute to malnutrition and stunted growth, just like in pigs. Severe complications are rarer, but they can happen like the worms blocking the intestine or migrating into the bile duct. Very serious when that occurs.
And you mentioned another syndrome, VLM.
Right, visceral larva migrans. A Suum is also a recognized cause of VLM. In VLM, the human acts as an aberrant or dead-end host. The ingested larvae hatch and migrate through the body's organs and tissues. But unlike in a pig, they don't complete the migration back to the intestine and mature into adults. They get lost, essentially. But their migration still triggers inflammation in the tissues they wander through. So symptoms often include things like fever, an enlarged liver, hepatomegaly, and typically a very high count of a specific type of white blood cell, the eosinophils, which fight parasites. Lung involvement is also common in VLM from Ascaris, causing cough, wheezing, and sometimes you see characteristic hazy patterns on chest CT scans called ground glass opacities.
Okay, so even if they don't mature, the larvae still cause problems. How do doctors diagnose these infections in people?
For the standard intestinal ascariasis, diagnosis is usually straightforward, finding the characteristic eggs in a stool sample under the microscope. During that acute lung phase, sometimes larvae can be found in sputum, but that's less common. Occasionally, adult worms might be seen on imaging, like an ultrasound or CT. For VLM, since there are no adult worms laying eggs, diagnosis is trickier. It relies on a combination of factors: the clinical signs, fever, enlarged liver, respiratory issues, a history of potential exposure, like contact with pigs or contaminated soil, finding that high eosinophil count in the blood, and often serological tests like an ELISA looking for antibodies the person's immune system has made against the Ascaris larvae.
And treatment. Is it treatable?
Oh yes, thankfully it's very treatable. Both the intestinal form and DLM caused by Suum respond well to standard antiparasitic medications. Drugs like albendazole, bendazole, or ivermectin are highly effective. So treatment itself isn't usually the major issue. The bigger challenge really is the prevention, especially given that zoonotic link and the parasite's environmental toughness.
What a journey we've taken. Seriously, that was a deep dive. We've really unpacked Ascaris from, well, from its incredibly tough egg, through its damaging journey inside the pig, the hidden economic costs, those tricky diagnostic challenges, and landing on this crucial need for an integrated One Health approach to control it. Hopefully you listening now have that shortcut, that real understanding of how this one worm connects food, economics, and health in ways most people just wouldn't even think about.
Absolutely. And it really highlights how a challenge like Ascarisum, which might seem like just an old agricultural issue, is actually a very modern, complex problem. It underscores that need for integrated thinking, for interdisciplinary solutions that span animal health, human health, and environmental management. Knowledge is great, but understanding how it connects and applying it, that's where the value is. It's a prime example of how interconnected everything really is.
Totally agree. So as you're mulling all this over, here's a final thought to leave you with. Considering the absolutely remarkable resilience of this parasite's egg, surviving for potentially decades in the environment, what truly innovative, maybe environmentally sustainable methods do you think could be explored? Beyond steam and flame and harsh chemicals, how can we really tackle inactivating those eggs in soil and manure effectively and safely for the long term? It's a big question, born from a fascinating parasite. We really hope this deep dive gave you some of those aha moments and maybe spark some curiosity to keep exploring these kinds of connections.